Coming up, a cutting-edge transcatheter valve therapy could be on the horizon. ACC President David Holmes and Society of Thoracic Surgeons President Michael Mack say it will be a transformational procedure. But will the FDA give it approval? Later, ACC CEO Jack Lewin will give his take on medication non-adherence. It is a major issue negatively affecting patients nationwide. It's costing the U.S. economy $300 billion annually. Dr. Lewin will shed some insights on how ACC members can help improve this problem. And we'll sit down and chat with ACC.12 co-chair Patrick O'Gara. He'll give us an inside glimpse into what attendees can expect at next year's scientific sessions in Chicago. Stay with us. Hello and welcome to this edition of the ACC Update for July. I'm Lisa Fletcher. A new societal overview of transcatheter valve therapy, written by ACC President David Holmes and Michael Mack, President of the Society of Thoracic Surgeons, provides a high-level look at what many believe could be transformational. The paper identifies some of the key issues that cardiovascular professionals and surgeons will likely need to be aware of as this unique therapy for valvular and structural heart disease moves forward.
As we think about new technology, it points the way to where we're going to go. Points the way to where we are today, but then we're going to go tomorrow. This is transformational technology. You might say, well, what is transformational technology? Transformational technology is technology that changes everything.
Both doctors highlight the importance of team-based care, complication management, and training and education for relevant physicians. They also address the need for data collection and evaluation, and caution that private and public payers are looking at coverage issues. This therapy has shown to be a good alternative for patients with severe aortic stenosis who are inoperable. The Food and Drug Administration is currently reviewing the technology. Meanwhile, plans are already underway, working hand-in-hand with other specialty societies to develop additional clinical guidance should the FDA give its okay. Stay tuned to cardiosource.org for more information. This past year has given rise to substantial changes in the traditional practice of cardiology. As a result, a large number of practices have chosen to integrate with hospitals, while others are searching for ways to remain private. Helping practices of all types navigate these changes and continue to thrive and provide quality cardiovascular care is a major priority for the college. Among the tools and resources available to practices, a comprehensive health IT resource center, the Pinnacle Network community, ongoing advocacy around Medicare and Medicaid coverage, and a dedicated practice administrator member group. Through programs like the Pinnacle Network, the college is also offering several upcoming events specifically designed to improve practice management. Beginning on September 1st, Paragon Health and Pinnacle Network are partnering on a 6-part webinar series focused on topics like Integration 101, CV Practice Revenue Cycle Management, and Clinical Co-Management. In addition, the ACC's annual legislative conference, September 11th through the 13th in Washington, D.C., will feature several educational sessions on payment reform and regulatory trends. Finally, don't miss the first ever CV Summit next January. Registration is open now. Check out cardiosource.org/practice management for more details. Taking medication as directed may seem simple, but non-adherence among people with chronic disease is a complex and widespread problem. This is particularly true in cardiology, where non-adherence can lead to serious consequences like hospitalization, cardiac events, and death. ACC CEO Jack Lewin addresses the problem of poor medication adherence and what ACC members can do to help their patients in the June-July issue of Cardiology magazine. Lewin writes, non-adherence has obvious poor outcomes for patients, but it also has negative effects for our health system. Non-adherence costs the U.S. economy $300 billion each year. ACC members can help their patients take their medication as prescribed by referring them to the National Consumer League's Script Your Future website, of which the ACC is a partner. The website offers medication adherence resources for providers and patients, such as free text message reminders, charts to keep track of medicines, and fact sheets. For more information on Script Your Future, visit scriptyourfuture.org. For other ways to improve medication adherence, read the full article online at cardiosource.org/cardiology magazine. You'll want to get registered for some of the important ACC events we'll highlight during our commercial break. When we return, we'll be joined by Patrick O'Gara to talk about some innovations attendees can expect at ACC.12 in Chicago. Stay with us.
Get the tools you need to lead your practice into the future at the Cardiovascular Care Summit, Solutions for Thriving in a Time of Change, January 12th through 14th, 2012. Register today for the best rates. Visit www.cardiosource.org/CV Summit for more information. Register now for the ACC's 2011 Legislative Conference, September 11th to 13th in Washington, D.C. Learn more about key issues facing cardiology. Meet directly with members of Congress. Don't miss the special Sunday night dinner to benefit the ACC PAC with featured speaker General Stanley McChrystal. Get the details at cardiosource.org/legislative conference.
Planning is already underway for the ACC's 61st Annual Scientific Session in Chicago, March 24th through the 27th, 2012. ACC President David Holmes has challenged those planning the meeting to think outside the box when it comes to structure, technology, content, and collaboration. Joining me to talk more about the ways the college is rising to this challenge is ACC.12 co-chair Patrick O'Gara. Welcome, Dr. O'Gara.
Thank you, Lisa.
Thanks for being here. So what are you and your co-chair, Rick Nishimura, approaching in terms of ideas for this meeting?
Well, Rick and I have the benefit of working closely with David Holmes, our current president, and ACC staff, who are extraordinarily creative in trying to truly rejuvenate the educational and science missions of the college. And we really see ACC 2012 as the showcase for science and education that the college here can represent and distribute to the world.
ACC 2011 got very high marks from the attendees. Are there plans to build off of anything from ACC 11 into 12?
Very much so. I think some of the major features of ACC 2011 that proved successful had to do with our programming around maintenance of certification. Many of our members utilized the national meeting in order to refresh the requirements that are necessary for them to become recertified. So we will have a heavy focus on recertification efforts at ACC 2011. I think, at ACC 2012. But I also would want to emphasize that we want to continue to leverage our relationship with our colleagues from TCT, or Transcatheter Therapeutics. We think that they have brought an enormous energy and creativity and content matter to the ACC I2 meetings of the past, and we certainly plan to leverage and capitalize on this relationship and to enhance it even further.
And what can we look forward to in terms of new elements?
Well, there'll be several new elements that Rick and I, in collaboration with David Holmes, envision. One, for example, is really the simple fact that there will be a single registration fee and a single registration process for any of the attendees. In years past, there have been essentially two different processes by which attendance was eligible to people both on the ACC side of the equation as well as the I2 side of the equation, and now we're going to consolidate that registration process. The meeting will start on Saturday, for example, compared with Sunday. It will run through Tuesday afternoon. And we're going to place an emphasis on the presentation of new science and cutting-edge investigation during each of the mornings on each of the days that we're in Chicago, whereas in the afternoon we will focus on the delivery of maintenance of certification programming as well as the application of that science into practice. So each of our days will have a very similar look and feel. This is in addition to the late-breaking clinical trials that we will bring to the meeting, and in addition, I think, to the named lectureships and some of the other new features that will help us get things off on the right foot. Let me back up and say that on Friday, which is the day prior to the official start of the meeting, Rick and I have envisioned an entire day's worth of activity that we plan to actually video and send by satellite connection to other cities, both here in the United States as well as internationally. So our Friday morning will start with what we like to refer to as a mega maintenance of certification program, in which Dr. Nishimura, for example, who is widely acclaimed to be the best teacher in the college, will be interacting with a group of about 150 people on site. But we plan to record this session and then broadcast it simultaneously by satellite to places like Rome and New York, and we're also working with our colleagues from Turkey. We have plans to solicit interest from other international sites. And in the afternoon of that first day, Friday, we envision having a session that we will name something along the lines of Masters in Cardiovascular Medicine. And we plan to invite 5 or 6 of the most highly acclaimed thought leaders in the field of cardiovascular medicine and surgery, and we would like to have a roundtable discussion that could be moderated by our journal editors, for example, from the Journal of the American College of Cardiology, as well as the journal Circulation, which is the American Heart Association's flagship journal. So we plan a Friday, the likes of which have not previously been seen, and we wish and we plan as well to broadcast this widely so that we can extend the reach of the meeting. We think that that's going to be a highly innovative and we hope popular feature.
I know a lot of things are still obviously in the planning stages. It's still early on, but at this point, do you have a favorite element, or do you have one issue that you're hoping attendees walk away with front of mind?
Well, we'd like to have the attendees walk away from the meeting with the thought that this was by far the most energetic and innovative program that they've attended in the past decade. And part of that process, I think, will also be performed or accomplished in conjunction with some of our other subspecialty societies with whom we plan to collaborate. We have some ongoing discussions with some of the major cardiology subspecialties. We'd like to bring them back to the tent, and we'd like to make our meeting valuable for their members and our own meeting even more valuable for our members. And we'd like people to walk away from the meeting with a sense that the cardiology community is a bit more cohesive. This is one place where you can be updated on the very latest in cardiovascular medicine and science, have your maintenance of certification along the way, and possibly get a glimpse of the future.
Sounds good. Dr. O'Gara, thank you for being here.
Thank you.
To learn more about ACC12, just go to www.accscientificsession.org. And that's all for this edition of the ACC Update for July. Continue to go to cardiosource.org for all the latest news from your college. I'm Lisa Fletcher. Thanks for watching.